my name is Dr. Mark Anthony Shepard, and I'm one of the co-founders here at Smile Genius, and I'm also the Director of Dental Operations. So I wanted to talk to you today about something that's very important in dentistry, and it's kind of like a hack, which has to do with refinements. Now, a refinement is when you get to about 80% of your treatments or more, and sometimes teeth in reality just don't track how you predicted them in your setup, your treatment setup. So usually you get a setup from the laboratory, and you'll have approved that for your aligner production. And sometimes it's just some stubborn teeth, or maybe the movements that you've chosen just were not suitable for aligners on their own, and sometimes you need supplementary work that you'd have to do in the clinic. But usually when you come to these points, and if you're unexperienced or if tooth just didn't make it, you have to do a refinement, which is essentially just starting again from where you left off and just printing a few additional aligners to finish a particular movement. Now I have about 4 big tips for you that should hopefully help to lessen the amount of refinements that you do in the clinic, and hopefully help to just get you more successful treatment outcomes right off the bat, instead of having to repeat those treatment options over again at the end. So the first thing that I have for you or the first tip that I have for you would be to always instruct your patients fully before they start treatment. A lot of dentists as well as doctors, we're very reluctant to give patient all the information. Sometimes that's because it's just an overkill. Sometimes you don't want the patient to be too confused. You just want them to get on with treatment just fine, without being inundated with all this information. But with clear aligners, one of the major causes of failure is patient compliance. And sometimes patient compliance comes down to 2 things. Sometimes they just don't know what they're looking for, and this causes them to miss a step. And especially when you start getting spaces between the tips of your teeth and the aligners called incisal gaps. This leads to the patient sometimes not realizing, and if you're only seeing your patient maybe every 3 to 5 aligners, it's very possible that they may just move past the point where they had incisal gaps, causing them to miss out on some tracking of some teeth. So the first important thing is have written guides, visual guides, YouTube videos, anything you have that can help the patient just to understand how their treatment is going to unfold. Have them understand maybe where their teeth are going to move at some stages, and what to expect in terms of what doesn't look right and when to contact you. We have nice guides here at the current clinic I'm working at, and that's just to really make everything super, super clear about what to expect during the treatment. And if they do run into certain situations, give them specific troubleshooting that they can do at home right away, or tell them when to call you right away so they don't continue their treatment until the point where you have this irreversible loss of tracking where you can't really manage anymore. So that's rule number 1. Make sure you get a good guide. Okay. Rule number 2 that a lot of dentists aren't actually familiar with is getting a good set of dimple pliers. Now, dimple pliers are pliers, right? But they have a small hole and a punch, but it doesn't exactly punch all the way through the aligners. What it does is it punches a small indentation in the aligners, and what it helps do is put a little bit of pressure within the aligner on a zone where the tooth may not be tracking correctly. Like for instance, if you're trying to complete the last little bit of a rotation, and you can see just from looking in the aligners that you have a small space between the tip of the tooth and the aligner where the tooth should be. What you can do is you can put a small indentation on the opposing side where you want the pressure to be pushed against the tooth pushing the tooth into the direction where you want it to go. Okay, and then you put a small indentation there, and you have the patient wear the aligners for a little longer. And this is a good way of helping a tooth track properly. Sometimes you might have to add a bit of IPR between those teeth to allow some clearance, because sometimes it's a matter of us working with a digital model and in reality, and sometimes the digital movements that we have just doesn't reflect in reality, because maybe there's a bit of lack of space, or there's a bit more friction in those areas. So dimple pliers, absolutely. If you don't have a set of dimple pliers in your arsenal for clear aligners, I highly, highly recommend you get those so that you can add a bit. So this is a small 1mm dimple plier. You have a lot of other ones. You have straight edge dimple pliers. You have more larger rounded dimple pliers. You know, you have different types for different locations and different sizes. So yeah, dimple pliers. Next thing would be elastics and buttons. So elastics, just your standard elastics that you would do in a metal orthodontic treatment. This is very important because sometimes you have teeth, for instance, that you're trying to extrude, and it's mainly for extrusions and rotations. But extrusions are totally difficult for some teeth, especially if you're trying to extrude canine, which is just being super stubborn because it's too high up, or any tooth really that's just stubborn, especially incisors, which even if you put attachments on them sometimes, you know, those incisors just tend, just their shape just cannot grip within the aligners. And sometimes you lose tracking there, where the best thing to do at that point would be to get something called a hole punch. So this is an aligner punch right there. It's a little bit of a thicker head, right? And so what that does is you can punch out a whole section of your aligner where you can put a button. And a button, I'll show a picture of the button, but it has a small area where you can, it's like a doorknob kind of shape that you put on the surface of the tooth, and then you would basically use that. You would put one on both sides of the teeth. Okay, so you put a button on the cervical of the tooth that you're looking to pull down, and then on the also on the cervical labial side, and then on the cervical of the palatal or lingual side. And then you would put the aligners on, run an elastic from the outside of the aligner all the way across to the palatal or the oral surface on the button on the opposing side. And this will help to pull the tooth into the aligner to help you get that movement without actually refining. And you probably have to leave that in there for a little bit of time, instructing the patient on how to put these elastics on the tooth to help this extrusion to happen. And this will save you this will save you a lot of time and money just reprinting aligners, especially if you're not using, you know, a one-time payment aligner plan. If you're paying per aligner, this helps save you some money on those aligners, boosting your profits, you know, and giving the patient an overall better treatment experience because it's not as long. Obviously, the aligners are not as clear at that point because you have kind of an external, mechanism of action that's happening on that tooth, but it's all worth it in the end because of the shorter time frame and less money spent. So elastics and buttons. The next thing would be prepping your treatment plan correctly, okay? And this is not so obvious sometimes because, you know, especially if you're new at clear aligners and you're getting your treatment plan right from the lab, you know, sometimes you do have a situation where they're just not making the treatment plan as, you know, functional as possible, but you may not be aware of some of these things. So two main things that you'll look out for, which a lot of the time cause refinements at the end of the treatment, is just first of all ensuring that there's no contacts between the anterior teeth. So that means the incisors. And as you know, there should be a physiological overjet and overbite of 2 millimeters. But sometimes, you know, the technicians are not totally aware of this, and they make treatment plans where you have this anterior contact. So that when you get to the end of treatment now, what happens is this anterior contact ends up being a premature contact, and the patient has trouble biting down the back teeth because, I mean, the front are just in contact first and the back are just not in contact. So by just simply instructing the lab to, you know, ensure that there's no anterior premature contacts, especially if you have a protocol in place where all your cases just fall under that rule, then that will help to significantly reduce the amount of refinements just from unnecessarily having teeth contacting unnecessarily in the front in the interior of the mouth. So that's very, very important. So try that out. The other thing is pretty much rotations. So rotations also sometimes don't happen in reality, even though you program them in, and a lot of the times just because there's no space to rotate the tooth, or just friction in general happens to keep rotations from moving, or it could be, you know, the actual cleanliness of the person too. They have poor oral hygiene, you know, their teeth are not as smooth, and it can lead to a little bit more resistance when it comes to tooth on tooth movement. So one tip would be, if there is enough space that that you can do it, is to ask for a bit of expansion and breaking the contact. So breaking the contact so it's free while rotating, and then you ask the lab to then pull the teeth together and align them at the end, so that you don't have this lack of space when you're rotating. But especially as you're going through treatment, if you do notice that there's a lack of rotation happening, sometimes what I like to do is, if I've not done any IPR or a very minimal amount of IPR in those areas, it's you can easily just take a 0.1 millimeter strip, and you can follow it between those teeth as long as everything is healthy and everything looks good there. You can do a small amount of following between those tips just to open the space a little bit, and then allow that tooth to finally rotate all the way around. But also, it would be to add a dimple in there as well, using your dimple pliers. If you need a bit more, if you need a bit more pressure to be applied to the teeth, you can do that as well. And that should help to reduce your refinements. Now, the last tip is super important. Now, a modern orthodontic treatment monitoring usually involves seeing the patient every so often. You know, maybe you'll see your patient every few aligners. That could be every month, every 2 months. Some people like to just allow their clients to just do their entire treatment at home without seeing them one time. But I can tell you that in those cases where you don't instruct your patient on how to look out for errors in their treatment, or you know, if they're just really bad at following instructions, this is where you kind of get, you know, the potential to have refinements at the end of treatment because of these issues. So what I would say is, if you have a really good treatment monitoring plan to help to monitor your patient's treatment at every stage, which, for instance, what I like to do is I like to ask for pictures throughout all my treatment process, so that I can see from stage to stage that the entire treatment process is working extremely well. And if I particularly notice anything, I can resolve those issues on the spot instead of waiting, you know, a couple aligners later or till the end of treatment, when then I'll have to do a full refinement and then take up additional time and money and resources in order to complete the case. So one of the best options that I love to use, and you know, also because we have invented this software specifically for this reason, but it is Smile Genius. And Smile Genius is so intuitive, and it's a great tool because not only does it help to monitor the treatment for you, right? So it will ask basically your patient to take photos as they change from aligner to aligner, and that will let you see their progress as they go from stage to stage. So that will help you to really keep a close eye on your patient's treatment. We also have a messaging system inside the treatment. So as they change from aligner to aligner, if you notice anything particularly, or you want them to stay on the stage for a bit longer, for instance, or use their chewies, or even come into the clinic, you can communicate with them directly to the app. On top of that, for compliance, it helps to give the patient notifications as to when to change their aligners, and also it prompts them to get to you right away if they're having issues. But it also has a resource center built into it. So if you want to upload your visual aids, if you have video aids, anything at all that you want to upload to help your patient get through their treatment fine, you can do that as well. We don't mind as well sharing our knowledge with you. So if you want to take advantage of some of the aligner guides that we have, we can help you with the wording and making a cheat sheet for your patients so that they can get through treatment a little bit better with your branding and everything like that. So we make it look like it just comes straight from you. We don't mind doing that at all, and really helping you to have a seamless treatment experience from start to finish. And once you know these rules, it's smooth sailing from there. You should be able to get a lot more clients because you're spending a lot less time on refinements, and you're spending a lot more time finishing cases on time and quickly. But I hope these tips really helped you. I'll have hopefully a course that I can teach you guys everything specifically, so I can teach you how to put the dimples, I can teach you how to make your aligner guides, I can teach you how to apply buttons and elastics, and actually give you some good case studies. But for now, these are my top tips. Please like our social media pages. We're Smile Genius Dental, at Smile Genius Dental, and that's for our Instagram, Facebook. We're also on YouTube and LinkedIn, so please give us a like and stay tuned for more educational pieces. We will continue to try to get you the best clear aligner practice out there, try to save you as much money as possible and boost your profits as much as possible as well. Until next time, have a great day or a great weekend, and talk to you soon. Bye.